Hello, my name is Dr. Kidney, and your doctor has asked me to explain to you what it means to have CKD. CKD stands for chronic kidney disease. By better understanding what it means to have CKD, you and your medical team will be in a much better position to take care of your kidneys. By the end of this short presentation, you should clearly understand the importance of knowing the answers to these three basic questions concerning your kidneys. Number 1, what percentage are my kidneys working at? Number 2, why are my kidneys weak? And number 3, how can I protect my kidneys? Your doctor will perform a series of tests that will allow him to answer these questions so you can better understand what your kidney situation is. You have 2 kidneys, and their main job is to continuously clean the blood and regulate the fluids and electrolytes in the blood. The heart, which acts as a big pump, sends blood to all your body parts. 20% of all the blood pumped out of the heart with each beat goes to the kidneys. Now, let's take a closer look at the kidney system. You have 2 kidney arteries which deliver the blood to the kidneys. The kidneys themselves act as filtering machines that clean the blood. The clean blood coming out of the kidneys is then delivered back to the heart by the kidney veins. The urine, which is actually made in the kidneys, is delivered to the bladder. The ureters are the 2 straw-like structures that connect the kidneys to the bladder. The urine is stored in the bladder. The bladder acts like a muscle sac that will then contract and expels the urine out into the toilet through another small tube called the urethra. Men and women have different anatomy that allows the urine to exit the body. In men, the prostate gland surrounds the urethra and can grow in size and cause partial blockage of the urethra. The kidney cartoon is a simple picture of the kidney system. It shows the kidney arteries delivering the blood to the kidneys. The kidneys clean the blood and deliver it to the bladder via the ureters. The bladder stores the urine until it contracts and pees it out into the toilet. The urologist, who is often referred to as a plumber, is a special doctor that takes care of the plumbing part of the kidney system. This includes the ureters, bladder, and urethra. He is a hands-on type of doctor who uses instruments to go up inside the urethra, bladder, or ureter to deal with blockages. In men, the prostate gland often becomes enlarged and can cause blockages of the urethra. The urologist may need to do a rotor-rooter job to open up the blockage. The nephrologist, who is often referred to as the engineer of the kidneys, is involved with the evaluation and treatment of diseases that cause CKD. Now that we have reviewed the anatomy of the kidney system, let's focus on the 3 important questions concerning your CKD. First, it is important to realize that CKD is a very, very common problem in the U.S. There are over 25 million people in the U.S. with CKD. And so, since you have CKD, you are on the same boat with all those other people. Unfortunately, CKD is a silent disease, and patients only develop symptoms when the combined function of both kidneys is less than 10%. The first thing we need to do is measure what percentage your kidneys are working at to see how weak they truly are. Simple blood tests allow us to estimate your percent kidney function. However, to get a more accurate measurement of your kidney function, your doctor will often ask you to perform a 24-hour urine collection. The lab will do special analysis on the 24-hour urine collection that allows a more true measurement of your kidney function. Next, the engineer will need to determine what is the cause of your CKD. From the kidney cartoon, we can separate the cause of CKD into 3 large groups. Number 1, problems with flow into the kidneys due to problems with the kidney arteries. Number 2, problems with urine flow out of the body, which can mean problems with the ureter, bladder, or urethra. And number 3, last but by far the most common cause of CKD is damage to the kidneys themselves. Most patients with CKD due to direct damage to the kidneys have one or more of the following risk factors: diabetes, hypertension, and being over the age of 70. Like a good detective, your kidney doctor will start by performing a detailed history and physical exam. Next, you will need a package of blood and urine tests along with a kidney ultrasound. In most cases, your kidney doctor will be able to tell you the most likely cause of your CKD based on assessing all this information. On rare occasions, a kidney biopsy may be necessary to make a definitive diagnosis. Now we have measurements of your kidney function and have determined the cause of your kidney disease. Next, we need to understand what can we do to protect your kidneys. Before tackling this question, we need to understand that in general, as we normally age, our body parts tend to wear down, and this includes our kidneys. The kidneys usually begin to show signs of weakening once we reach 50 years of age. In general, a normal, healthy person loses 1% of kidney function every year after the age of 50. So, for example, a healthy 80-year-old's kidney function would be approximately 70%. They would have lost 30% kidney function as they aged from age 50 to 80. Unfortunately, for most patients with CKD, there is no treatment to make the kidney function better. To make things even worse, most patients with CKD lose kidney function much faster than 1% per year. Some patients with CKD can lose 5% or even 10% kidney function per year. Therefore, the focus for you and your doctor is to slow the rate at which your kidney function gets weaker. Once the renal function becomes very weak and reaches 10%, patients need to go on dialysis or get a kidney transplant. Therefore, it is crucial to do everything we can to slow the progression of CKD. As it stands now, we have a limited number of interventions that are helpful in slowing the rate at which the kidney function weakens. These interventions include good blood pressure control, strict blood sugar control, cholesterol control, and very importantly, avoidance of certain medications that can be potentially harmful to the kidneys. The most concerning group of medications to avoid are called the NSAIDs, NSAIDs, which stands for non-steroidal anti-inflammatory drugs. These include both over-the-counter and prescription medications used to treat pain, and arthritis in particular. Some of the common medications on the market include Motrin, ibuprofen, Aleve, Advil, and Naproxen. We recommend use of Tylenol at moderate doses, and if stronger pain meds are needed, then your doctor will need to prescribe special pain-relieving medications. He must avoid use of NSAIDs. Your doctor will need to go over with you these specific tools to optimize your kidney protection. He will also need to design a schedule for monitoring the results of these interventions and track the progression of your CKD. In summary, your doctor has identified you as a patient with CKD. By understanding the 3 important questions concerning you and your kidneys, you are in a much better position to team up with your doctors to form a kidney team protection plan, focusing on slowing the progression of your kidney disease. Our hope is that by working together, that we can certainly delay, if not avoid, your progressing to the 10% kidney function point, and thus delaying or avoiding the need for dialysis or kidney transplantation.